Do I need surgery to fix my back? Hey everybody, this is Mike Erlob with another episode of Power Your Life. You know, this is a common question that I get all the time. You know, from my clients in the clinic. It's, Mike, do I need surgery to fix my back? You know, a lot of people with back problems, you know, that's one of the first things you think about. When the first time you experience an injury, the first time you experience that pain traveling down the leg, the first time you realize that you're having trouble just putting on your socks and shoes in the morning, or just being able to put your pants on and try to lift your leg up, and you get that shooting pain that goes all the way down the leg. You know, it conjures up all kinds of concerns, and you know, it's a valid concern because there are cases where yes, you might need surgery, and there's other cases where no, you don't need surgery at all. And you know, it's a matter of knowing which one is it. And you know, because this is such a common question, because this is such a common concern that we all have, I wanted to share with you the experience that I had with a really good friend of mine. So I'm going to call him Matt, and Matt's not his real name, but he's actually a client of mine right now, and so I don't want to violate HIPAA or any identifying information out there. But anyway, Matt has back pain, and let me tell you a little bit. I want to give you a little bit of backstory about Matt, and kind of go from the beginning to now and his experience, and I hope that this can help you. So I've known Matt for almost 30 years, and he's been a very good friend of mine. Matt was a former power lifter, still actively lifts, still, you know, very strong, big guy. And you know, he did a lot of heavy lifting, you know, back in the day, back when actually Matt and I used to compete against each other in the powerlifting meets, you know, and he was extremely strong, and you know, he could squat, you know, the world. I mean, he could squat, you know, well over 700 pounds, bench press over 500 pounds, you know, deadlift over 700 pounds, just an extremely strong individual. But, you know, over the years, that took the toll on Matt's back, just like it did on mine. And, you know, he would get a hold of me from time to time, and he'd have to come into the clinic, and you know, we would get him straightened out. And he would be good. You know, he would just get a little kind of soreness in his back, and it would feel like he was really tight and he just couldn't get it stretched out. And so we would bring him in, and in 3 or 4 sessions he was good to go, and he would be good for maybe 6 months to a year. And then something different happened with Matt. Was that last year, it was I believe in the late fall, he started having some more pain in the right side of his lower back that really bothered him when he was, we call it stooping, but he said it's when he brushes his teeth. You know, when he stands at the sink, and you know how it is, you know, you're kind of leaning over as you're brushing your teeth, trying to, you know, not get the toothpaste all over the place and get it in the sink. And it was really killing him in that right side of the lower back. So, you know, we restarted another round of therapy with him. And this time that was different because his body wasn't responding to what we were doing before. So I knew something was up. And, you know, it was probably maybe after about our 6th session, he came to me and he said, you know, I'm getting this clicking back here. I'm getting this clicking in kind of my SI joint area. And it every time I lift my leg or I bend forward, and you know, I would check him out, and you could actually feel there was this clicking back there. And his sacroiliac or SI joint, it was not out of alignment. It was fine. We were addressing all of the right things, and he was just still having that pain. I referred him on to a back specialist, to a spine surgeon, and initially they decided not to do anything other than they did some injections, and they did, you know, kind of the typical send him back to therapy again. And, you know, he got a little bit better, but then right before Christmas time, he started getting pain in his right big toe, and it was starting to go numb. And immediately I knew this was not This was not getting him better. And so I stopped things with Matt, and I said, hey, listen, you need to go back to your surgeon. And so he did. He went back to his surgeon, and I ended up, they did an MRI, and his discs, he had a very bad disc at L5-S1. And then there was a cyst that had formed along that nerve root. So ultimately it was decided that the best avenue of approach for him was to get it surgically fixed. And so he went in and he had surgery, and they did a L5-S1 fusion. And this is where it gets interesting, because so when Matt came out of his, and this was in late March, so there was a pretty big cyst on that nerve root on that right side. That's what was causing the pain going down the leg. And that cyst, there wasn't anything that anyone's going to be able to do to take that cyst away, other than to go in and take that out. Well, and because of the shape of his discs and the vertebrae, they didn't have a choice but to do a fusion too. So, in Matt's case, that was what needed to happen. But where it gets interesting is the fact that Matt called me up about 6 weeks, after the surgery, and he said, "Hey, listen," he said, "my surgeon, he really isn't recommending that I do any therapy. He's having me do a couple visits at his clinic with his therapist, but he said, Matt told me, he said, I'm not getting anything out of it. They're not having me do anything that's really, I don't feel is addressing any of the issues." And I said, "Well, you know what, Matt, what are the issues that you're having?" And he said, I still have numbness in my big toe. And he said, since the surgery, I can't lift my foot up. I can't, how it is if you're sitting down on the floor and you've got your foot flat, and if you were to lift your foot up, he couldn't do that. And the surgeon said that, well, this is just part of the inflammation around the nerve, and this will get better with time. And Matt said, "Well, Mike, listen," he said, why should I be waiting? It doesn't it make sense if I start coming in and working on getting that nerve to start firing again?" And I said, "Well, absolutely. Because if you have compression on a nerve root, it's like I told Matt, it's like a straw, okay? So that nerve, comes off of the spine, and then it travels down into the muscles, and then the electrical impulses go through that nerve. And it's like trying to drink a milkshake through a straw, and you've crimped the straw. Now you can't get the milkshake through." And I said, anytime you activate that nerve, you're going to increase the ability for it to heal. It just makes sense. And he said, "Yeah, well, my surgeon, he's not recommending that. He doesn't think it'll do any good." And you see, right then and there, I told Matt, I said, this is the thing right now. Right now, that is what frustrates me the most with our current medical system, is the fact that we think about fixing the problem. And in Matt's case, the problem was, let's remove the cyst, okay, off of the nerve root. Let's fuse the vertebrae together. And then his doctors just say, "Well, that's good. We don't need to do anything further." And that just does not make sense, because the problem is all of the imbalances, all of the things that had happened in Matt's body, which placed the extra stress on his spine to cause the cyst to form, to wear out the disc to where he had to have that fusion. Those imbalances and those other issues are still in his body. Not to mention, he has a nerve that isn't conducting the impulses enough. And so, I told Matt, I said, Matt, it is your choice. It is up to you if you want to have, come back in and start working on this. We will work with you. And so Matt did, that's what most people don't know, is that as a patient, it is your choice, okay? So you have to be proactive with your own health to know, hey, this is what I need to do. I can't just be passive, sit back and do let's sit and wait, because if this nerve doesn't regenerate, I may never get the ability to lift my foot back up. And that's what Matt and I talked about. So he did. He came back in, and we restarted working with him. Now, because he had a fusion, obviously, I had to be very careful and mindful of that surgery. You just can't start going at it really hard and trying to rehab his entire leg and body. And, the amazing thing is we started working with Matt right at the middle of May. And when he came into the clinic, Matt could not, as I said, sit down and lift his foot up. I call that the toe lift test. He couldn't do that. He couldn't break it off the ground. And now he's able to break it 2 inches up off of the ground. He's within about an inch of his other side. He's walking better. He's feeling better. He did mention, we talked yesterday, and the reason I'm bringing this up is he said, hey, I'm feeling a lot better, but I can't get my foot on top of I'm having trouble sitting in a figure 4, getting my foot on top of my other knee just to put my socks on, because he's restricted. He can't bend forward too much because of that fusion and the healing that still has to happen. And we talked about the importance of the hips and getting the hips to open, getting hip openers and getting those hips to loosen up, because the conversation we had is all about the hips have to be moving and healthy in order for your spine to be moving and be healthy. And, he said, well, yeah, that makes sense, but, why hasn't anybody told me this? And I said, that's the other thing that frustrates me, is there's not enough good information, that's coming out. And I said, Matt, listen, you have a spine that's now has one segment that's locked up, and that segment is never going to move again. It's fused together. But you still have to be able to eventually bend forward, bend backward, twist and bend and lift. You have to be able to put your socks and shoes on. So all of the added stress that your spine is going to take is going to be now, instead of distributed between 5 discs, because you have 5 lumbar vertebrae, is now going to be spread upon 4, which means there's increased stress. Now, your hips are directly related to your spine. So if your hips are not moving correctly as well, imagine how much more stress is going to be generated into the spine. And that leads us to what we call the domino effect, which is, hey, you know what? You have a fusion, you get it fixed, and guess what? A few years later, the pain starts to return. The level above it is now going bad. So now they have to go in and remove that disc and fuse that. And you feel good for a few years, and guess what? The level above that now starts to go bad. And it just ends up this chain of events. And that's the message that I want to drive home with you is, listen, if you do have surgery, and that is the direction you have to go, and sometimes it is, just remember that the surgery just fixes that structure. It doesn't, it fixes the part that's generating the pain. It does not fix everything that caused that to happen. It doesn't fix the root cause. And Matt mentioned to me, he said, hey, I have another friend. My other friend is Jeff. And, Jeff's a little bit younger than me. And, Jeff has already had a fusion a few years back. And now his back is getting bad again. And he's actually looking at having another fusion. And I said, exactly. I said, because in Jeff's case, his problem that was causing the wearing out of the discs, those causes were never addressed. Because I asked him, I said, Matt, did Jeff go back into therapy? No, he never did therapy. His doctor said he didn't need it. See, and that was a huge mistake. That is really a big mistake. Surgery can fix the issue, but it doesn't fix the reason that the issue started, okay? It doesn't fix the root cause. Think of it like, I like to explain this as the front end of the car, all right? So when your tires on the front end, when those tires are worn out, you go to the tire store and you get a new set of tires. Now, if you get a new set of tires and you don't realign that front end, you are going to wear those tires out again within 1 or 2 years. Like immediately your car is going to drive great, but over the course of time, you're going to get uneven wear. You may even get excessive wear to the point where maybe some steel belts start to poke through. I've seen that happen. And, all because you didn't do that alignment, and now you're right back to where you were, and you have to get a new set of tires. Nobody would think of doing that. You would never think about getting a new set of tires that cost you, $700 to $1,000 and not spend that $100 to align your front end. That just doesn't make sense. We just don't do that. It's the same thing with your body, okay? Your body, you have to address the imbalances. It's these imbalances that cause that portion of the spine to wear out. It just isn't your desk one day. And this goes true for a disc herniation, for cysts that form, for degenerative disc disease. Your body just doesn't decide, oh, hey, I think, I'm going to degenerate. This is occurring because of the unnatural forces that are being pushed onto your spine because there is physical imbalances, meaning tight hip flexors, immobile hips, weak glutes, weak quads, weak lower abdominals. All of those things place increased compression onto the spine. There's also nutritional imbalances. That's a huge one. Like in Jeff's case, some of the degeneration that he's facing actually does occur from the fact of that if you're eating the standard American diet, which is a very acidic diet, it promotes increased degeneration of the cartilage and the collagen in your body because your body is more acidic. So if you're not balancing your nutrition, you're really putting yourself at a huge disadvantage. And then there's the mental imbalances. And I'm talking about how you manage stress and how you balance your work life and family work, type of balance, and how you manage that stress and how you get all of that put together, because that has a huge impact on your overall health as well. All of these play a part. And, whether you have surgery or not, you have to fix what's caused it. You've got to get in, you've got to see somebody, and you've got to have them analyze all of these imbalances that are existing and then work step by step to correct those. And only then can you expect that, okay, I'm going to have a healthy spine and a healthy life after this. But if you just think, well, I'm going to get the surgery and that's it, I'm going to be good to go, you're sadly mistaken. So the answer to the question that I have for my clients is yes, sometimes surgery is necessary and sometimes it is not. You should always be more conservative at first because you can always do surgery later if you need to. But here's the thing, if you do elect to have surgery, then you have to understand that it does not fix all of those imbalances and all of those issues in the body and in your life that actually caused that problem to begin with. And those have to be addressed or you're going to be right back to square one. I want to leave you with a quote, an inspirational quote coming up. And we've got the 4th of July weekend coming up, but Winston, this is a quote that I just really spoke to me from Winston Churchill, and it says that without courage, all other virtues lose their meaning. I want to kind of leave you with that quote right now. And oh, by the way, if you would like to learn more about how to fix your back, just shoot me a message on Facebook. I got a new ebook. I'm going to give that to you free. So just message me on Facebook, ask for my new free ebook, and it's called The 5 Best Kept Secrets to Fast Back Pain Relief. I'm more than happy to send that to you. It's got a lot of great information in it. I want you all to have a fun and safe 4th of July. So we will see you all next Tuesday. Until then, keep moving forward.